Thank you so much, Senator Sparks. Following on with Senator Cook's questions, one statement of that requirement of not abandoning a patient and living up to one's Hippocratic oath says, it's not a physician's job to tell patients how to live according to the physician's personal code of ethics, whether religious or secular, nor should a physician withhold treatment from a patient simply because they fail to adhere to his or her personal standards of morality. Do you agree with that?
I'm sorry, would you repeat that one more time?
Absolutely. It's not a physician's job to tell patients how to live according to the physician's personal code of ethics, whether religious or secular, nor should a physician withhold treatment from patients simply because they fail to adhere to his or her personal standards of morality.
Right. I would say that, again, we're trying to make sure that we don't put our healthcare workers in a position where it challenges their conscience, right? So I do have a little bit of an issue with the statement.
So I would assume that it's, you believe that a physician should be able to withhold treatment from patients because the patient's failure to adhere to to the doctor's standards of morality.
No, not necessarily. I think that mischaracterizes it. Again, this bill contemplates these things being determined ahead of time. So I don't think it puts him in a position where the doctor or the healthcare provider is actually trying to impose his or her moral or religious convictions.
So should a pediatrician be able to withhold a measles vaccine because they have a moral issue with vaccination?
I think that would be covered under this, yes. I think it would be covered, yes.
So that would require the patient to go find another physician willing to provide this completely legal vaccine.
Yes, I believe that's true.
Similarly, if the physician has a moral issue with antibiotics and their patient has requested antibiotics for a illness that's indicative of being treated by antibiotics, if the physician has a deeply held moral issue with antibiotics, that patient must find a different physician.
I believe that's true, yes.
Contraception, same thing. If the physician has a deeply held position with regard to contraception, that patient would need to go find a different physician, even though contraception is legal.
Yes.
Thank you for answering my questions.
Yeah, thank you for your questions.